Dr. Kosterman here with Kosterman Chiropractic in Cary, North Carolina. And in this video series, we're continuing to talk about shoulder pain. So in this video series, or in this video in particular, we're going to talk about 3 simple tests that you can do at home to kind of figure out if the problem's coming from your shoulder, right? The shoulder is a complex joint. You know, the shoulder itself has about 8 or 9 muscle attachments, depending on who you ask or which book you look in. But the whole shoulder girdle has about 8 muscle attachments to it. So it's a complex joint. And again, it can come from an old injury, a new injury, a chronic injury, or some other pathologies underlying. So, you know, the caveat with this is I'm going to give you these 3 tests to check and see if it's coming from your shoulder. But if it's something that you just can't figure out, go see a medical provider, healthcare provider, and have them check it out to make sure something more serious isn't going on underneath. But with that being said, shoulder pain is very specific. So we have to find out if it's coming from your shoulder, because shoulder pain can come from the shoulder itself and the muscles, the tendons, the ligaments attached to the shoulder, or it can come from the back, the spine, the scapula, or the shoulder blade. It can even come from the elbow and refer up. It can come from nerves that are compressed in the neck. So these are 3 easy tests that you can do at home just to kind of find out if it's coming from your shoulder. The first one is called the abduction test. And with this, you're just going to go through some easy range of motions. You're going to start here and you're just going to raise that arm all the way up, and you really want to get that arm all the way to the top. When you bring it back down nice and slow, I want you to stop and hold it at 90 degrees. Now, seems easy enough, but you know if your shoulder's hurting and you have some impingement, it's going to be a challenge to do that. So if you get pain with this, that is indicative of a shoulder problem. Or if you get pain, obviously with moving it all the way up, but you notice when you bring it all the way down and you try to hold it, it just simply falls and you can't hold it, that's indicative of a shoulder problem. Or if you are unable to get it up, let's say it just won't go all the way to the top, that's indicative of a shoulder problem. And it could be indicative of a serious shoulder problem, especially if it's dropping while you're holding, a serious rotator cuff problem, which needs to be evaluated thoroughly. The second test that we're going to do is a simple range of motion. So let's say we're testing the left side. So you're just going to simply reach over the top and grab the opposite shoulder blade and go as far as humanly possible to try to grab that area, right? So if you're doing that and you feel some stress or strain or pain in that joint that's reproducing what you're having, it's probably coming from the shoulder. Third test is the least amount of fun, but essentially what you're going to do is you're going to turn around, take the hand that's bothering you, go up and under, up as high as you can, and try to reach that opposite shoulder blade. This is not a very fun one if you're having shoulder problems. It's either going to be hard to do, it's going to be restricted, meaning you can't get there, or the pain inhibits you from getting there, or you just can't do it because of the pain. So all 3 of these tell you that there's probably some type of rotator cuff issue in there. There could be tendonitis, there could be tendinopathy if it's been in there long enough, some type of strain or injury, or at the very worst, some type of arthritis or degeneration where the tissue is just worn out. But at any rate, it's, you know, if you go through these and it does reproduce your shoulder pain, then it's probably a good idea to get assessed or checked by a healthcare or medical provider just to find out what's going on, so you can have a plan that's built out for you to see if you need further testing like an x-ray or an MRI. But thanks so much for watching the video. If you have any questions, please let us know, and we'll see you in the next one.